If your child has anxiety, we focus on the brain. His job is to keep you safe, so feeling anxious and worried is completely normal. However, your brain cannot decide what is a real threat and what is not. Your brain will think of everything as being a danger, but we can switch it up. When we are feeling anxious and worried, we're sitting in the emotional part of the brain. That is the amygdala. And the amygdala's job is to keep you safe, and it gives you all of those worried and anxious feelings. However, go from feeling anxious to feeling okay, we need to switch the brain. We need to switch the brain to the part of the brain called the prefrontal cortex. And that is the thinking part of the brain. And that is the brain that will help you rationalize and understand that there is not a real danger or a real threat. There are 3 things that we do to switch the brain from the emotional brain to the thinking brain. The first thing that we do is we acknowledge the feeling. So we acknowledge the part of the brain that is making us feel anxious. We acknowledge that it's doing its job, and we acknowledge and understand that that is completely normal. The second thing that we do is we shut up the amygdala. So we tell the amygdala that it's okay, but we're not going to listen to it. And we're going to carry on with our plans anyway. We're going to do the thing that makes us feel nervous or anxious because it is not going to kill us, and we are completely fine. The thing that we do is we switch the brain. We switch the brain to that prefrontal cortex thinking brain. And there are a few ways that you can do this. Switch our brain to the thinking brain, we use something called the 3 whys. And we ask ourselves 3 questions to make that transition between the amygdala and the thinking brain, the prefrontal cortex. Our 3 questions that we use in schools, residential children's homes, and with our foster care children are this. Number 1. Are you safe? That causes the brain to question and to switch from the emotional to the thinking, because the child or the adult has to think, am I safe? The second question is, are you hurt? And that again helps switch the brain from the emotional brain to the prefrontal cortex thinking brain. Am I hurt? Am I hurt? And that causes a full body scan and switch in the brain. And the third question that we ask is, are you loved? Am I loved? So we can then transfer the thinking. To get the brain from the emotional brain to the thinking brain, we need to engage thought. So that can be used through things like distraction or questioning. If you would like to know more information about behaviour, you are in the right place. I'm Danielle Douglas. Let's talk behaviour.